Welcome to Lesson 1. Our topic is related to falls. Falls can be defined as unintentional event that result in a person coming to the rest on the ground or another lower level. Falls are extremely common among older adults. And each year, about 1 over 3 people older age than 65 years old who living in the community will falls, and this rate increases with advanced age and is higher among people who are living in institutional setting. Falls can cause considerable increasing in mortality and morbidity in older people. There are 3 phases in falls, namely initiating events, system failure, and impact phases. In phase 1, initiating events involve extrinsic factors such as environmental hazards, and also internal factors such as unstable joints, muscle weaknesses, and unreliable posture reflexes. Physical activities in progress at the time of the fall. Next, in phase 2, system failure. Failure of the system for maintaining upright posture to detect and correct this displacement in time to avoid a fall. This is generally the factor intrinsic to the individual, such as loss of sensory functions, impaired central processing, and muscle weaknesses. In phase 3, the impact phase, an impact of the body on environmental surfaces, usually the floor or ground, which result in the transmission of force to the body tissue and organs. This is followed by a phase of sequel, which may be physical, psychological, or social, all with disabling prospects. And these are the examples of internal risk factors for falls that include gait and balance impairment, peripheral neuropathy, vestibular dysfunction, muscle weaknesses, vision impairment, medical illnesses, advanced age, impaired activity of daily living, orthostasis, dementia, and drugs. While for the extrinsic risk factor in falls, they could be due to environmental hazards, poor footwear, and restraints. In terms of assessment, taking a detailed history of circumstance of the falls, which can point to a specific etiology or narrow down the differential diagnosis. This may include sudden rise from a lying or sitting positions, trip or slip, or drop attacks. And also leads to looking up or sideways or loss of consciousness. And the most important part in terms of physical examination, they include gait assessment, sensory assessment, they include hearing and vision, measurement of orthostatic vital signs, neurological assessment, musculoskeletal assessment, depression and cognitive impairment screening, and also a review of footwear and gait aids appropriateness. In terms of interventions, numerous studies recommend that home assessment and modification for high-risk individuals, prescribed exercise program that include strength, balance, and gait components, vitamin D supplementation, review medications, management of postural hypotension, expedient cataract surgery on the first affected eye, considered pacing in cardio-inhibitory carotid sinus hypersensitivity and recurrent falls, management of the foot problem, and patient and caregiver education, especially on the importance of specific environmental improvement. This is the end of our presentation. Thank you everyone, and do scan this QR code for quiz and practical session. Bye!